Now, the Ghana Health Service is warning that the disregard for COVID-19 preventive protocols risks plunging the country into a third wave. Director General of Ghana Health Service, Dr. Patrick Kumar-Boaje, describes the threat as real and urges a relook at the adherence and enforcement of safety protocols. As of July 17, Ghana recorded a total of 99,734 COVID-19 positive cases with 817 deaths, and the country's active cases of 3,466 leave health authorities worried. Dr. Patrick Kumar-Boaje has been explaining why the country is experiencing an upsurge in cases since December.
There has been a gradual increase in cases over the past weeks. For example, between the 11th and 25th of April 2021, a total of 968 cases were recorded for the 2-week period, compared to 2,500 recorded from the 1st to the 14th of July 2021. The increase in cases have largely been from the major hospitals, Accra, Greater Accra, and Ashanti region, with a few sporadic outbreaks in other regions such as Volta and Eastern regions. The rise in cases is of concern to the Ghana Health Service, and this necessitated the strategic meeting of senior managers and our partners to address the increase in these cases. Ladies and gentlemen, our current system has some inherent strengths. Capacity for case management has been strengthened with an increase in the number of treatment centers from 2 to about 70 currently, with a treatment center in each region. And this is something that has been ongoing since the last wave. Training of critical care staff and the provision of equipment has also been implemented. The establishment of the Ghana Infectious Disease Center is one. The establishment of electronic data collection system for surveillance data collection, a robust laboratory capacity from 2 in the early 2020 to 400 total currently. We also have a capacity for genomic sequencing as a country, and that we've been sequencing since the last few months. And we also have a strong expanded program of immunization that has been demonstrated since the vaccination started. However, all this capacity can be overwhelmed if we do not avert a third wave, especially driven by a Delta variant, which is highly transmissible.
Now, he also outlined some stringent measures that the service will be rolling out to control the rapid spread of the virus.
Part of the protocols that have been designed includes how funerals, etc., should be organized. And just like the protocol, I think it's not being adhered to not just by one group of people, but clearly many people are doing that. We are in discussions coming up with a proposal that limits the spread, that makes it safer. And whilst people still go ahead and have funeral, we think that it's such a deep cultural thing that it is not something you can just wish away. And so we have a draft protocol that we are sharing to ensure that, how do we ensure that we still have our funerals in safety?
Let's take a look at the latest figures as are being reported in the regions, and you have that on your screen now. 304 new cases have been reported, bringing the active cases up to 3,466. The number of deaths, as we reported earlier, 817. Right. Now, the number of active cases as per regions is showing a rise in the Greater Accra region as well, 1,893. That shows close to 100 new cases in the Greater Accra region, 1,049 cases in the Ashanti region, also showing a massive increase there. We understand 100 cases of the new Delta variant have been discovered in the Ashanti region in the past 2 weeks. Following those is, interestingly enough, these trends often spread from Greater Accra through Eastern to Ashanti, or Greater Accra to Ashanti to Western. But we are seeing that the Bunu area, the 3 Bunu regions, there are 72 cases, 58 cases, and 32 cases for the Ahafo region. And the Bunu East region has the third highest number of cases in the country with 72 cases. The Volta region follows with 71 cases, and then we go to the Eastern region with 44 cases, the Ahafo region with 32 cases. Before you come, well, the Western region has 34, before the Ahafo region with 32 cases. Then the Central region has 20, the rest have below 10. Now, we stay with COVID because the health service says a recent rise in the number of COVID-19 cases is of concern, and this has necessitated a strategic meeting of senior managers to assess or to address the issue. Now, here are the highlights of a press statement released after that meeting. And you have that press statement on your screen. It says that capacity for case management has been strengthened, with an increase in number of treatment services or treatment centers from 2 to over 70, currently with a treatment center in each region. Also, training of critical staff and provision of equipment has been done. Establishment of the Ghana Infectious Disease Center, or GHS, has also been done. Also, the establishment of an electronic data collection system for surveillance data collection. Robust laboratory capacity from 2 in early 2020 to over 43 currently, and capacity for genomic sequencing. This is how we know which variant is at play. And a strong expanded program on immunization. These are the strengths of the current system. But which gaps are we addressing? First of all, disregard of COVID-19 safety protocols. Now, addressing it would mean mobilization of opinion leaders, religious leaders, traditional leaders, key influencers, etc., putting in place contextualized risk communication measures for locations, such as schools, workplace, etc., establish and enforce adherence to COVID-19 safety protocols where appropriate. Also in the laboratories, scale up testing capacity for COVID-19, and antigen testing will be used as part of rapid response in locations where there are outbreaks, such as schools, workplaces, and at POEs. Surveillance, we are strengthening contact tracing, quarantine, and isolation. And with case management, we continue to strengthen the capacity for case management, including oxygen supply. We also request, that's the Ghana Health Service speaking here, that all persons who fall ill must report to the nearest health facility for testing and appropriate treatment. Now, in terms of vaccines, Ghana is increasing capacity to handle different brands of vaccines, including those that require ultra-cold storage facilities. Ghana is also trying to source more vaccines to cover many people, or as many people as possible, prioritizing hotspots, populated areas, and at-risk groups. And vaccine hesitancy needs to be tackled, which is basically the unwillingness of the citizenry or the general population to take the vaccines. Now, at points of entry, the gaps being addressed are recommending the use of rapid diagnostic tests at all points of entry. Also, monitoring the situation at the Kotoka International Airport on COVID-19 cases arriving in Ghana and instituting appropriate measures, and surveillance and screening to be undertaken at seaports and landing beaches.